So today I'm going to talk about the various risk factors for heart disease. Whenever we talk about heart disease, what people most commonly associate heart disease with is high BP and high cholesterol. But this is not even a fraction of the truth. What actually causes heart disease in the first place? Let's try and understand what's the root cause. Where is it starting from? Right? So, where it starts from is actually the endothelium. The endothelium is the innermost thin lining of your arteries. Yeah, so arteries are your blood vessels which are carrying the oxygenated blood from your heart to the rest of your body parts. Okay, so when this endothelium gets damaged, okay, when there's a tear or a cut in the endothelium, basically that is where your heart disease begins. So whenever there's a cut or tear, what will the body try to do? The body will try to repair it, right? Now the body tries to repair it by forming a plug or a clot to seal that damage. All right. Now this is made up of a lot of different things. So there's your inflammatory markers, your WBCs. Yeah. So there's a specialized type of WBCs called phagocytes. These phagocytes are like specialized cells basically, which help to trap any foreign substance. Yeah. And what these phagocytes end up trapping is cholesterol. More specifically, the LDL, which we call as the bad cholesterol. But now you see that in this whole story, the cholesterol is just coming towards the end to sort of, seal the deal. But is that the culprit? Just because someone came there at the end, can you blame the person who came there at the end, or do you blame the person who was there from the beginning? From the beginning, right? Because if that didn't happen, if the endothelium didn't get damaged, all this would never occur. The rest of the story does not matter if your endothelium was never damaged in the first place. Correct? So our whole focus has to be to prevent that damage to the endothelium, okay, rather than cholesterol, because cholesterol is literally the last thing, and poor thing, it gets blamed unnecessarily. All right, so we will talk about cholesterol more in one of the future videos. But for now, just understand that's not the culprit, and the focus needs to be more on reducing the damage to the endothelium. So how does this damage occur? It occurs primarily because of three things. The first thing is your chemicals in the food. So all of us know that these days a lot of chemicals in the food that we are eating. The second thing is the higher insulin levels that we have already spoken about in detail in our last video. And the third thing is oxidative stress. Okay, so we'll talk about oxidative stress and chemicals in the food more in detail in a separate video. All right, so stay tuned and we'll come up with the next video soon. Bye bye.